Welcome everyone. We have been talking about brain trauma in the earlier session. Let us continue with the remaining part of this brain trauma. Today we are going to talk first about brain tumors. Now sometimes the brain is injured not by an accident or a blow as we have been talking about earlier, but it can be by a pressure inside the skull rather than an external force. And this inside the skull, why the pressure is created? It is because of a formation of a tumor. The intracranial growths or brain tumors can lead both to acute and chronic disorders. In such cases, the speed with which the intruding body develops also influences the amount of loss for an individual. A tumor might grow slowly for a long time before there is any evidence of intracranial pressure or behavioral change for that matter. Tumors produce a variety of physiological and psychological changes because their presence causes a rise in intracranial pressure, as I told you, and interferes with the blood supply to the brain. You see here in the picture, towards the right you see in this particular picture how a tumor which is depicted in a separate color can influence the individual and individual's functioning, cognitive functioning, normal functioning, behaviorally in every possible way. Well, a tumor can invade and destroy normal brain tissue, as you are able to see in these two pictures of the brain tumors. Towards the left you are seeing a tumor which is marked in pinkish color, in a different color as compared to the other part of the brain. This tumor can invade and destroy normal brain tissue as depicted in this particular picture. Now the second picture shows a tumor which can press on normal tissue and increase the pressure within the brain, as we have been talking about so far. Thus, I am showing you two different pictures of the tumor which can cause an effect upon the behavior and cognitive functioning of an individual, which create a pressure and which may interfere with the blood supply to the brain. As with head injuries, the symptoms of a tumor depend upon the location of the tumor in the brain. Just as the head injuries can have differential impact depending upon the location of the injury, even tumors depending upon their location may have a differential impact. For example, tumors growing in or near the frontal lobes frequently lead to a gradual onset of mental changes, but again the symptoms depend upon the site of the tumor and many other factors too. One group of people with frontal lobe tumors, for example, may become exuberant and euphoric with their conversation punctuated by laughter and jokes, and another group may show general apathy and slowness in responding. So it depends upon the site, it depends upon various other factors too. Memory disorders generally are very common in people with cerebral tumors and are often first noticeable indication that a problem does exist. This is the first indication of the problem. A good prognosis in cases of brain injury or tumor depends upon how early and how accurately the condition is diagnosed. So diagnosis is very important, and also based upon the diagnosis, whether an effective treatment of the condition is given or not is equally important. You see in this particular picture the lobes of the brain, like for example frontal lobe, parietal lobe and occipital lobe, all are shown over here, and the areas which are involved and the functions which these lobes are responsible to are also depicted over here. Like you are seeing here, for example, the speech, movement and sensory functions, and you see here the hearing, sensation, and you see here the movement. Of course, temporal lobe is over here. You see the hearing and vision. You see that certain parts of the brain and certain lobes are responsible for certain functions of an individual. So as I just said, the location of the tumor, that is the site of the tumor, that determines which function of the individual is affected. Here you see in this particular picture, in a different color, the tumor is marked, and you see that around the tumor there is an inflammation, and there is a distortion of brain tissue. We talked about the intracranial pressure that a tumor can exist, and this picture shows very clearly that. In this picture, once again you see that in the brain this person has the tumor is indicated in a different color, and the top picture shows a healthy brain with no tumor. Whereas the second picture, the lower picture, shows a brain which has tumor, and around the tumor you also see the inflammation, which is indicated with the help of arrows. So this is where the intracranial pressure that we have been talking about, and also the site of the tumor and the size of the tumor and where it is located, all determine the functions of the individual which are affected. Let us now talk about the classification of tumors. Tumors can be classified either as metastatic or primary. Metastatic brain tumors originate in a different part of the body and then they metastasize, that is spread to the brain. Usually they develop from cancer of the lung or breast or stomach or kidney, and from there they travel to the brain through blood vessels. By contrast, primary brain tumor, as the very name suggests, as you are seeing that the name is different, right? The primary brain tumors are intracerebral, that is they grow inside the brain tissue. Others are extracerebral, growing outside the brain but inside the skull, often in the meninges. Though they are not exactly within the brain, they are inside the skull, often in the meninges. Intracranial tumors are more frequently seen in the adults, and extracranial tumors, which we have talked about, are seen very often in children. What could be the causes of tumors? Actually, the exact cause of tumors has not yet been determined. Their clinical course, however, is clear. How they develop, that course is clear. For some reason, a few cells begin to grow at an abnormally rapid rate, and they destroy the surrounding healthy brain tissue and result in a wide variety of psychological symptoms that we have been talking about. In most cases, the first signs of tumor are subtle and insidious, like for example headaches, seizures, visual problems, neglect in personal hygiene, indifference to previously valued activities, what have been very important to them, and failures of judgment and foresight. In this way, in a variety of ways, the manifestation of the first signs of brain tumor may be seen. With the progressive destruction of brain tissue, as we have seen in the pictures that I have shown to you, the patient eventually develops at least one or more of obvious symptoms, like for example abnormal reflexes, blunting of the affect, disorientation with regard to time, place or person, or person. Then poor memory and concentration, double vision and jerky motor coordination. The person who is undergoing these problems, as this picture shows, is in a totally different agonized state altogether, owing to all these symptoms with the progressive destruction of brain tissue. The kind and severity of symptoms are directly related to the location of tumor in the brain, as I have repeatedly told you. The functions controlled by that section are probably impaired earlier and more severely as compared to the other functions. So, the area where the tumor is located, the functions which are related to that area are first more severely affected, and more severely affected as compared to the other zones. However, as the tumor grows, it is not limited to only that particular area, it presses against the other sections as well, and so the functioning which is related to the other areas of the brain is also affected. Any tumor which continues to grow untreated in the brain will eventually cause extreme physical distress. It may be seen in the splitting headaches, vomiting, seizures, along with the personality changes which may reach even psychotic proportions. Having talked so much about tumors, what are the possible risk factors? Even about the risk factors, not much is really known. About all that can be said is that some types of cancer, such as lung cancer, metastasize to the brain, as I have discussed and described a little while ago. Significant risk factor, for example, of lung cancer is smoking. Hence, prevention lies in being able to take care in such a way that people do not have the risk of cancers, to minimize the risk of cancers, like for example limiting the smoking. Once this is limited, probably the further risks of brain tumor can also be limited. Having talked about prevention, we have to talk about something which is very important, that is the treatment, and the treatment is medical. Several types of tumors can be removed surgically, and in many cases they are removed surgically. However, because the surgery itself can cause additional brain damage, the medical doctor may choose to avoid it depending upon the location of the tumor. Like for example, surgeons are especially reluctant to operate on the language areas and on the major motor areas. So in such cases what they do is radiation treatment is given, though this can destroy the brain tissue too. In other cases, surgery, chemotherapy, radiation are used in combination as well. Remember, there is a possibility of metastasis. We have discussed about the metastasis, both to remove the growth and to prevent future growths. We have discussed at length about brain tumors as a reason behind brain trauma. Let us now talk about the last type of brain trauma, that is caused due to infections. Infectious disorders often have an acute onset, although the possibility of slow acting viral infections cannot be ruled out. Central nervous system often is more susceptible to bodily infections than other tissues of the body. Some of these infections do not last long, and successful treatments have been worked out for many of them. But if left untreated, some of these infections can lead to irreversible brain disorders. Let's basically talk about three major categories of brain infection. They are cerebral abscess, encephalitis and meningitis. Cerebral abscess is an infection which becomes encapsulated by connective tissue. You are seeing in this picture the abscess. You see that it is as a part of the brain tissue. Because this cannot drain and heal like an infection on the outside of the body, it simply continues to grow inside the body. These brain abscesses usually occur when an infection in another part of the body travels to the brain, or when a foreign object such as a piece of a sharp object enters the brain introducing germs. However, with improved measures for preventing infection after injury, these cerebral abscesses have become rare comparatively. So, the second type is encephalitis. It is a generic term meaning an inflammation of the brain. It is caused by direct infection of the brain by viral, bacterial, parasitic or fungal agents. A large number of organisms are known to cause thus encephalitis. Here you are seeing a picture of a normal brain towards the left, wherein there is, you don't see any problem, it is absolutely fine. Whereas in figure 2, you see a brain which is infected, that is encephalitis is there. You see the white markings out here which indicate the encephalitis. As compared to the remaining portion of the brain, look at the portion which has been infected. So, it's a large number of organisms including bacteria, viral, bacterial, parasitic or fungal agents, any of these can cause this encephalitis. In fact, let us talk about one particular epidemic in encephalitis which was called as sleeping sickness, which was widespread following World War I. Its most striking symptoms were profound lethargy and prolonged periods of sleep, often for days or even weeks at a time. I hope now you understand why it was called sleeping sickness. I hope now you understand why it was called sleeping sickness. In their periods of wakefulness, however, the patients might become extremely hyperactive, irritable and then breathless, unable to sleep. That is during the periods of wakefulness, which may be there in between. Other symptoms include convulsive seizures and delirium. Once again, delirium has already been discussed in other sessions. It is a state of excitement and disorientation marked by incoherent speech, restless activity and often hallucinations as well. Epidemic encephalitis often leads to death. And in those who survive, and especially in children who are more susceptible to epidemic encephalitis, the disease often leaves an altered personality. In many cases, a sociopathic personality as well. So, that is about encephalitis. Now, let us talk about meningitis. As the name indicates, meningitis is related to meninges. Another type of cerebral infection where an acute inflammation of the meninges is seen. Meninges are the membranous covering of the brain and spinal cord. It is caused by bacterial infection that is introduced to the brain directly as a result of an injury that penetrates the brain, thereby causing an open head wound. Through an infection elsewhere in the body or via bloodstream, this can be spread. Among the symptoms which are usually observed in meningitis, there are certain striking symptoms like drowsiness, fever, headache, stiff neck, confusion, irritability, inability to concentrate, memory deficits and sensory impairments as well. In milder cases, the primary infection may be effectively eliminated, but residual effects may be there like motor and sensory impairments, and in infants mental retardation is not uncommon. You see here on the right side, we are able to see the normal picture which has been depicted over here. Normal meninges are seen in the upper part of the picture, and in the lower part you see the meningitis. You see the pink portion which is affected, that is through meningitis. Having talked about how brain can be infected, let us talk about the common brain infections which are described across the world. These are the common infections which are reported across the world, and sometimes they are seen more often in certain areas of the world as well. And today we are going to talk about General Paresis, HIV-associated cognitive impairment, mad cow disease and Lyme disease. There are others too, but today we are going to limit our discussion to this. We will first talk about General Paresis. It was termed as neurosyphilis, the deterioration of brain tissue as a result of disorder called syphilis, which was once far more common than any other form of encephalitis. This was a very common disease some time back. It was not until the late 19th century that the degenerative disorder called General Paresis was finally linked to the syphilis. One of the results of untreated syphilis in its later stage, this General Paresis, or which is also called dementia paralytica, it's a progressive deterioration in psychological and motor functioning which results in paralysis, psychosis and ultimately death. Among the symptoms of General Paresis are loss of cognitive functions, slurring of speech, tremors of the tongue and lips and poor motor coordination. These symptoms are progressive and eventually lead to a helpless condition of the individual. Here you see the part of the brain which is colored differently, which is the infected part. That is the part which is damaged. Throughout the previous centuries, syphilis had raged unchecked throughout Europe and other parts, taking a huge toll in infant mortality, blindness, madness and death as well. With the development of certain early detection procedures like Wassermann test and with advent of penicillin, the incidence of syphilis has decreased dramatically in the late 1940s and 1950s. Otherwise, it was really rampant prior to that. Prompt diagnosis and medical treatment of syphilitic infections is the best approach to reduce the incidence of General Paresis. So, having talked about General Paresis, let us now talk about another type of impairment, that is HIV-associated cognitive impairment. Many AIDS patients display cognitive impairment. Individuals who are infected with HIV but do not show AIDS show no evidence of clinically relevant cognitive impairment. Neuropsychological difficulties develop in 30 to 50% of individuals with HIV infection. While these usually take the form of mild cognitive changes, a small percentage of infected individuals develop serious cognitive impairment, which is referred to as HIV dementia, which we are going to talk about today. Well, cognitive impairment is seen in this HIV dementia. The early symptoms of HIV dementia sometimes go unnoticed or even mistaken for certain other problems, be they physiological or psychological. In many cases, cognitive changes are the first sign of acquired immunodeficiency syndrome, that is AIDS. At first, patients may seem forgetful, apathetic, withdrawn, and even depressed or anxious, or both depressed and anxious. Later, they become confused, disoriented, and uncoordinated. In their final stages, the patients may go blind, have seizures, become mute, and lapse into a coma. While that is the description of the symptoms of HIV dementia, let us go to another type of problem called mad cow disease. Mad cow disease is one of the several fatal infectious diseases called spongiform encephalopathies that attack the brain in both animals and humans. You are seeing the picture where a human brain is shown. Beside that, the brain section which shows spongiform pathology characteristic of what is called Creutzfeldt-Jakob syndrome, which we will be talking about now. Over the past, the disease has hit herds of cattle in Britain, and it might have spread to some consumers who ate the contaminated beef. In human beings, this type of encephalopathy is called Creutzfeldt-Jakob disease. The first signs of infection are memory loss or confusion, sometimes accompanied by behavioral change or difficulty in walking. As the disease progresses, visual perception and motor skills gradually deteriorate. They rapidly deteriorate and the patient falls into dementia. Death occurs within 4 months after the onset of the illness. Autopsies of the patients have revealed widespread degeneration of the brain tissue, as you are seeing in this picture, which is depicted over here. Plaques composed of prions or protein deposits have encrusted or replaced what were once normal neurons. Though further research remains to be done, scientists strongly suspect prion to be the cause of the infection. Yet another disease which we are going to talk about today in terms of infections which lead to brain damage is Lyme disease. Lyme disease is the most common tick-borne disease in the United States, with more than 15,000 cases reported each year. And ticks acquire the disease by feeding on infected animal hosts such as deer and then spread it to the humans. Usually, as you see in this picture, Lyme disease begins as a slowly expanding ring-like rash at the site of the tick bite. You see that in this picture. Please look at the ring-like rash which is seen at the site of the tick bite, and this slowly expands. The lesion is frequently accompanied by mild flu-like symptoms like low-grade fever, fatigue and headache. And over the next few weeks, however, the infection may spread to central nervous system, heart and joints. When Lyme disease does affect the central nervous system, according to researchers, in about 15% of the untreated patients, it can lead to encephalitis or meningitis. We have discussed about these two a little while ago. Victims may experience a variety of cognitive difficulties such as poor memory or slowed thinking and psychological symptoms such as anxiety or mood disturbances. Lyme disease can be treated with antibiotics, but despite treatment with either oral or intravenous antibiotics, a small percentage of patients in United States, it seems, continue to suffer from persistent joint inflammation, neurocognitive difficulties and fatigue for months and even years after therapy, according to reports. This disabling syndrome is sometimes called chronic Lyme disease. Having said that these are the various infections which lead to brain damage, let us also talk about the risk factors. Often the source of cerebral infection is unknown. Encephalitis can be caused by many common illnesses including measles, mumps, influenza. People who are infected with Epstein-Barr or herpes simplex virus can also develop encephalitis. Similarly, groups at risk for HIV infection are at greater risk than the general population for developing dementia. Another common source of infection is organisms which are transmitted through insect and rodent bites. Some of these predictably can be prevented if proper measures are taken, like for example HIV infection. The care which is taken to see that the infection is not acquired is important. Coming to the treatment then, the treatment of brain injuries caused by infection depends upon the type of infection. Most bacterial infections are treatable with antibiotics. Cerebral fungal infections are also treatable according to medical experts if they are identified correctly, properly and in right time. Viral infections are more challenging to treat as compared to the others according to medical experts. Where does the role of psychologist come? Well, a psychologist's role may be important in terms of help with the memory and cognitive problems which we have been talking about, and also the personality changes. Many people find that psychological support is an important part of their longer term recovery and rehabilitation.